Has a complete cure for diabetes been discovered? Diabetes, a chronic condition affecting millions worldwide, has always been managed but never fully cured. Recently, China has made bold claims of achieving a breakthrough in the treatment of diabetes through stem cell therapy. While this development is exciting, it is undergoing thorough evaluation, with Western countries conducting extensive research and studies to validate these claims. In today's explainer, we'll delve deeper into China's advancements in diabetes treatment and examine what this could mean for the future of healthcare. The breakthrough in China. A report published in the renowned journal Nature highlights groundbreaking work by Chinese scientists. According to the study, they successfully treated patients suffering from both type 1 and type 2 diabetes using stem cell therapy. This achievement marks a significant milestone, as diabetes has long been considered a lifelong condition requiring constant management. How the treatment works. The treatment involves a cutting-edge approach using the patient's own stem cells. Here's how the process unfolds. Stem cell extraction. Stem cells are collected from the patient's body, typically from sources like bone marrow or adipose, fat tissue. These cells have the unique ability to transform into various types of cells. Laboratory reprogramming. In the lab, these stem cells are reprogrammed to develop into insulin-producing beta cells. Beta cells are responsible for producing insulin in the pancreas, which regulates blood glucose levels. Transplantation. Once reprogrammed, these cells are transplanted back into the patient's pancreas. The results have been remarkable. After the procedure, the patient's pancreas began producing sufficient insulin to maintain healthy blood sugar levels. This means their bodies are now capable of naturally regulating glucose without relying entirely on external insulin injections or medication. Outcomes of the study: 2 patients, one with type 1 diabetes and the other with type 2 diabetes, were part of this study. Both individuals showed significant improvement in their condition. Their pancreas started producing insulin independently. Their blood glucose levels were successfully regulated. They were prescribed minimal medications for maintenance. These findings suggest that stem cell therapy has the potential to not only treat, but possibly cure diabetes by addressing its root cause, the lack of insulin production. The road ahead. While these results are promising, experts caution that further research is essential. The therapy needs to undergo extensive clinical trials involving larger groups of patients to ensure its safety, efficacy, and long-term sustainability. Additionally, scientists are investigating whether this approach can prevent the immune system from attacking the newly introduced beta cells, a common issue in type 1 diabetes. What this means for the future. If stem cell therapy proves successful on a broader scale, it could revolutionize diabetes treatment, offering a permanent solution to millions of patients worldwide. This would drastically reduce dependence on insulin injections, improve quality of life, and alleviate the economic burden of managing this condition. However, it's important to note that such breakthroughs often require years of testing and refinement before becoming widely available. For now, the global medical community remains cautiously optimistic as they continue to evaluate China's groundbreaking claims. In conclusion, while a complete cure for diabetes is not yet confirmed, these advancements in stem cell therapy offer hope for a future where diabetes can be effectively treated and perhaps even eradicated. Let me know if you'd like to expand on any specific part or focus on a particular aspect of the treatment. As of 2024, over 800 million adults worldwide are living with diabetes, a significant increase from previous estimates. This number has more than quadrupled since 1990, when approximately 108 million adults were affected. The global prevalence of diabetes in adults has risen from 7% in 1990 to 14% in 2022. This surge is particularly pronounced in low- and middle-income countries, which now account for nearly 80% of the global diabetic population. Alarmingly, more than half of these individuals are not receiving necessary treatment, leading to severe health complications and increased mortality rates. Projections indicate that the number of people living with diabetes will continue to rise, reaching approximately 643 million by 2030 and 783 million by 2045. This escalating trend underscores the urgent need for comprehensive global strategies focused on prevention, early detection, and effective management of diabetes to mitigate its impact on public health. The pancreas of both patients, which has developed insulin required to maintain the blood glucose level, and they do not need medicines.